In India and all over the world, knee joint arthritis is a big health burden because it causes a lot of pain and disability, very poor life quality, and costly treatment. Hello, my name is Dr. Kalpit Patel, and in 20 years of practice as a specialist in knee joint orthopedic problems, the majority of my patients have been diagnosed as having knee joint arthritis. As you might know, arthritis is a disease affecting our joints. We usually do knee joint replacement surgery in our patients having the last stage of knee joint osteoarthritis. And often their son or daughter asks me, Doctor, my knees are fine today, but what are the chances of me suffering from this knee joint problem later in my life? And my answer is there is no sure way of predicting who among us will end up suffering from knee joint arthritis, but as it is related to our aging process, most of us will suffer from some form of knee arthritis after the age of 50. Let's try to understand the basics by knowing what our knee joint actually looks like and how it functions. From inside, our knee is formed where the end of the thigh bone femur, the leg bone tibia, and the kneecap patella come in contact with the help of a smooth cushion called cartilage and paddings called meniscus. These allow our knee to take the loads of standing, walking, and running without any friction between the bones. The knee joint is kept stable with the help of strong ligaments and muscles. A special lubricating fluid inside the knee keeps our knee movements pain-free and noiseless. In knee joint osteoarthritis, the part of the smooth layers of cartilage become thin and start to break away. The rough bone ends touch, causing friction and pain. The ligaments become weak and the knee feels unstable. The lubricating oil dries up and the body reacts by producing unnecessary extra bone around knee, causing stiffness. So how does one know that knee joint arthritis has started? Early stages of arthritis, people will have mild knee pain and swelling at the end of the day's work. There will be some difficulty in stair climbing and sports activities. Then I need an X-ray of the knee joint, but the correct way of doing it is in standing or what we call as a weight-bearing position, because otherwise it gives misleading information. The X-rays not only confirm the diagnosis of knee joint arthritis but also provide us information about the angles and the stage of the damage of the arthritis. Sometimes I might need additional investigations like CT scan, MRI, or fluid analysis before starting the treatment. Instead of the routine painkillers, I try to focus on the lifestyle changes to fight this disease. So one should avoid sitting on the floor and squatting, try to use Western toilets. Interestingly, the scientists have found out that our knee joints bear 3 times our body weight. So one has to try to reduce the load on the knee joints by weight reduction using scientific weight loss techniques. Moreover, the bones around the knee joint need to be strengthened by having calcium-rich diet, calcium supplements, and glucosamine tablets. One should stand and walk wearing the knee braces or knee belts to provide the additional support to the weak ligaments around the knee. However, a word of caution, these hyped up knee braces do not change the mechanical axis of our leg, and so one has to give due importance to the knee exercises. There cannot be any excuses like I do not find time for exercises or there are no gardens and gyms near my home. Also, there is a wrong notion that walking will damage the arthritic joint. In fact, daily walking and at least 5 kilometers of walking a week in sunlight is required to maintain the bone strength and calcium density in the knee bones. Yes, one must wear a kneecap while walking or jogging and wear proper footwear with air cushions. For those who are interested in sports with knee arthritis, It is advisable to do a warm-up exercises before and a cool down afterwards.